Welcome to Madison Noteworthy Health. Thanks for joining us today. I'm Dr. Frank Byrne, your host, and I'm delighted to be here today with Dr. Praveen Sinha, the CEO and co-founder of HealthMyne. Praveen, thanks for joining us.
Thank you, Frank.
So let's start at the beginning. What is HealthMyne and why is it important?
Well, HealthMyne is an imaging informatics company. We formed in January of 2013. What we plan to do is to make radiologists' life easy. So to explain it more, imaging in medical sense is 90% of the data. Now, we are generating more and more images and more clinical data for the doctors to look at and diagnose. Our job at HealthMyne is to provide a platform that makes their job easier by providing some imaging analytics and cohort analysis and other tools so they can do their analysis much faster.
So what your software is doing is basically assisting the radiologist in making the right diagnosis, helping them do that more efficiently, and thereby helping their patients by getting the most accurate diagnosis in a shorter time frame.
Absolutely. So the two of the innovations in our product is first, what we call is quantitative imaging. So as we like to say, and other people know, imaging is not just pretty pictures. Imaging has a lot of data. Images are full of data. We are extracting that data, the most useful data from there, and presenting it to the doctors so they can make their diagnosis a lot more accurate and a lot more faster. Second innovation is integration with the clinical systems. As you know, there has been a rapid increase in adoption of EMR systems, but even now, the EMR systems and the PACS system, which is the imaging system, are in two different silos. Right. Our job is to bring them together and provide as much relevant quantitative information to the diagnosing physicians to make their job easier.
So what you're doing then is taking the information from the imaging system, which previously has been a separate silo, if you will, and making sure that it's fully integrated into the electronic health record.
Absolutely. And not only that, but providing a lot more quantitative insights into that imaging to the doctors to make better diagnosis.
Now, what advice would you have for folks, entrepreneurs who have a great idea about healthcare IT and making things better for patients and for people who provide care? What advice would you give them, Praveen?
Well, first of all, I will say that in my 20 years in this space, I've never seen so much excitement about healthcare IT from all areas, from the investor community, from the provider community, from the payer community, from the government. So it is a very exciting time to be in healthcare IT. So I welcome and encourage more people who want to start companies in healthcare IT. Having said that, I would say that listen to the customer, be close to the customer. First, identify who your customer is, and then be close to them. Your first customer is your best salesperson. So also try to make your customers not only engaged in the product, but also empower them so they are the ones who are your best salespeople. They go and tell others about your product. And in healthcare space, that is very, very important because it's not, at least we are not in consumer space, we are in the provider space.
Yeah, and so it's important that the customer embrace the product and they can be your best evangelist, it sounds like.
Absolutely.
So that, ladies and gentlemen, is the definition of a serial entrepreneur. Dr. Praveen Sinha, you can see that he's clearly not resting on his laurels and the wonderful success he's had in the past. He's super excited about HealthMyne and what that's going to do to improve patient care and the experience of caregivers. So thank you, Praveen, for joining me today.
Well, thank you, Frank.
And thank you for joining us on Madison Noteworthy Health. I'm Dr. Frank Byrne, your host. See you next time.